At the CHUM hospital, for some, it's bring your own tissue. I saw this report on TV, so I decided to bring my own, she says. While it might seem like an odd way to save money, staff have had to console crying patients and families by handing them brown paper towel. We hid this employee's identity because she fears repercussions. We do the best we can because there are people who are in mourning or in pain, she says. We don't want them to have to worry about having to bring their own Kleenex on top of everything. The CHUM says we took this decision within our organizational framework with our teams and patients and with the spirit of good supply management. To illustrate the cost, I bought this box of tissues at a pharmacy for $1.50. With 82 sheets inside, that comes out to less than 2 cents per sheet.
With this kind of penny pinching, it has to be a problem of real financial situation.
Patients' rights advocate Paul Brunet says this is just the latest spending decision that has him embarrassed.
Shame is like pain. You only feel it once. So I don't feel it anymore because there's so much shame.
The CHUM says tissues are still available in certain parts of the hospital. But the health minister told CTV there are situations which aren't defendable. I'm demanding managers use better judgment. And the opposition agrees.
I can't imagine being somebody who learns that they have cancer and being handed a roll of brown paper.
It's really shocking, this lack of dignity for people who go to the hospital.
But while the tissue issue is drawing outrage from some, for others, it's better than the alternative.
Worrying about Kleenexes in the hospital is really not important. We have a lack of doctors, a lack of medical staff.
If they're going to be cut, I'd rather see Kleenex than staff.
In the latest budget, Quebec spent $3.9 billion on healthcare and social services. But now, the cost of tissue is in question. Kelly Gregg, CTV News.